So you're here today to see if you're really a candidate for stem cell therapy. And I'm going to try to explain this to you as easily as I can. First of all, the type of cells that we use are the only cells that are approved by the FDA. There's different types that other centers have, such as fat or adipose-derived, or something that's taken from a baby, such as amniotic fluid or placental fluid. Those are not allowed by the FDA. The only one that's allowed, the only one that's been allowed, is bone marrow derived, and that's what we use. So right from the beginning, we're going to give you something that's approved by the FDA. Second of all, we have to understand how these cells work, so then you can understand why you could be a candidate or why you may not be a candidate. So these cells work by correcting a biochemical problem. First of all, they reduce a certain chemical that's in your joint called interleukin-1 beta. So they reduce that bad chemical. Second of all, they restore this cell-to-cell communication. Those cells that are in your joint right now all serve a specific function. They're all there to work together to get your joint moving. But when you start getting arthritis, those cells stop talking to each other. And this therapy gets them to talk to each other so they can communicate efficiently. It's called paracrine signaling. So it restores paracrine signaling. And then thirdly, it regenerates homeostasis. Now notice I didn't say regenerates new tissue or cartilage, which it can, but not directly. It regenerates that normal, nice balance between damage and repair. Every day we have damage that occurs to our joints, and every day we have repair. What's been happening is that you've had a lot more damage than what your body's repairing, and this then levels the playing ground and gets that even. So again, we reduce, we restore, and we regenerate. Because it really only corrects a biochemical problem, we have to look at things that could be a biomechanical problem to your joint and see if that outweighs the benefit. So if your joint is really bent or bowed more than 8 to 10 degrees in either direction, you may not be a good candidate. If you also have some loss of motion of your joint, more than 20 degrees of normal, you may not be a really good candidate. If you also have episodes where your knee or your joint gives out and it's unstable 2 more times a week, that is a biomechanical problem. Now, sometimes we can correct that first and then allow you to be a candidate, but that has to be addressed. And then finally, if your joint is swollen all the time and needs frequent aspirations of removing that fluid, the biochemical problem may be too far gone for you to be an optimal candidate for this. Not only do we have to look at that, but we have to also look at your other medical problems that could occur, the whole person. So what are the things that are going on in your body right now that could or could not make you a good candidate? So sometimes you have risk factors, medical risk factors, that make you too high of a risk for a major surgery like a joint replacement. So certain things like your weight being with a BMI over 40, if you have serious heart disease, if you have a clotting disorder, if you've had previous infections, if your kidney is failing, all those things have to be taken into account for us to come out with what is the best treatment specific to your situation. And not only that, we also have to look at your social situation, because you're going to need somebody to help you out after a joint replacement. They're going to have to be there a good 2 to 3 weeks, 24 hours a day. And if you don't have that support, maybe that's not the best choice for you. The good thing about these cell-based treatments is that you can recover in a day, sometimes 7 to 10 days, if you need some minor surgical procedure. And so we have to take that into account. So we take all these things into account because not every single patient is a candidate. And not every single patient will respond exactly the same way. But these are your cells. This is for your healing, and you should at least have that choice. And we're going to help walk you through that process.